Hi everybody, Martin Kelly from IBM Venture Capital. I'm here at HealthXL. I'm joined by Dave Gibson from GSK. Dave is Head of Innovation and he's been with us today for the first Mentor Network Day. So, how was it?
Great. It's not often you get a room with so many high potential individuals, people who've done it before, investors, mentors, entrepreneurs, and I think everybody here could kind of a willingness to learn.
Right.
I think everybody's new to the space, so it's exciting.
Cool. So we had 25 mentors, VCs, angels, entrepreneurs around the block, and then we saw some of the teams. So what are the areas within digital health that are interesting for you and GSK?
Well, I think there's some kind of short-term areas like looking at adherence, how getting people more adherence to the drugs. I think ultimately as a theme, it's like anything that can help you demonstrate the value of a drug, whether it be them being more adherent, whether it demonstrates the medicine actually works better, whether it can how it can demonstrate the economic benefit of the drug as well. So any technology, service or solution in those areas is something we're interested in. I think the great thing about digital health is we know broadly what digital health will offer, and it's going to be much more around the total solution, not just a pill, but managing someone's wellness and healthcare. I think what's exciting is we just don't know what all the solutions are yet, and that's what for us the HealthXL program really brings to us, an opportunity to learn what some of those solutions are, and really to learn from the entrepreneurs, because we're not experts in this area. So I think put together, maybe we both can become the experts.
Cool. So what's the figure? 40%? A successful drug, blockbuster, costs about $1 billion to bring to market, and 40% in time is it's more than that. I think it's nearly $2 billion in 15 years. Wow.
And yeah, I mean, you say 40%, but in reality, there's probably greater than 10,000 targets screened before you get to one you even look at. So I mean, the probability of success is low.
Okay.
However, I mean, if you find drugs in key therapeutic areas, I mean, the returns can be big, and there's huge benefits in terms of dealing with some big diseases. But the practical reality is as well now that a lot of the big disease areas have treatments for them.
Right.
So cardiovascular disease, respiratory diseases, and we'll continue to develop medicines in those areas. But a lot more of the new medicines are in much more niche areas, much more kind of personalised medicines. In small, like things like lupus, Lou Gehrig's disease, cystic fibrosis, and they bring kind of additional challenges, which is they need to be more specific. They take the same amount of time, the same amount of money to develop smaller markets, smaller revenues. Right. And so with products like that, you need to look beyond the pill itself and say, what other things can we add here to demonstrate that the product works, demonstrate its value for money.
Okay. You've done a very interesting job in terms of getting GSK engaged, so getting the right stakeholders and getting the people locally and internationally. So how have you sold it internally, those folks?
I think when it's a good concept, it always sells itself.
Okay.
But I think really, like any entrepreneur, I mean, I'm an entrepreneur in a big company. Right. You gotta have a clear story. You gotta be able to demonstrate why the company needs to do it. Yeah. Why they need to do it now. Got to be tenacious in it too, and actually, don't be afraid when people push it back a few times. And this is a program. This is a program where we're learning. So it really is our first venture into digital health. Right. So this is not a huge financial investment for GSK, but it's a very strategically important thing for us to do. So I think really it's telling that story. Don't be pushed back. And then finding some key advocates within the company who believe in your story. Okay, great. And when an entrepreneur approaches you, what advice do you have? I get entrepreneurs come to me and say, within 2 minutes they're asking me for money, right? They hardly know what we're interested in, and you think, my advice is always you got to try and build a relationship. You got to try and understand the person. What advice do you give to entrepreneurs that approach you? Yeah, I mean, so from a GSK perspective is understand the business, understand the industry, and understand the needs. Firstly, don't try and sell a solution. Right. Don't try and sell a technology. Right. If you come to me with a technology that doesn't have any applicability to our business, you're not going to be interested. You're not going to be interested. But you're absolutely right. Try and understand me. Yeah. What value can you offer me? Yeah. how can I sell it within the company for you.
Right.
So make it a compelling story for me as well.
Yeah. Okay, great. Dave, thanks for coming down. Yeah. Cheers.